Hello everyone, welcome to sqadia.com. I'm Hina Khan and today the topic of our lecture is psychological treatments. Now, when we talk about the psychological treatments, they can range from the psychotherapies that just relate to the counseling sessions and sometimes the cognitive behavioral therapies, in which basically there are different theories that are revolving around and that are revolving behind these cognitive behavioral therapies, as well as the operant therapies that are being currently used by the psychiatrists or by the psychologists even who owe to these treatments. Now, we can also couple these psychotherapies with the pharmacotherapy sometimes if the disease is of a severe form. So over here in these sections, we'll be talking about primarily, first of all, about the psychotherapies, and then we'll be moving on to the biomedical therapies. So the key features of both of these therapies will be discussed over here, and then we'll move on to the treatment in the past. So one should know what were the pros and cons in the past and how the advances has basically moved on with the passage of time. The psychotherapies and the biomedical therapies primarily will be discussed over here. What are the techniques that are quite specific to these therapies will be discussed over here in this very first section. Moving on to the second section, we'll be focusing on the psychoanalysis of the patients. So whenever you have a patient at your hand who is suffering from any kind of a mental disorder, for example, it can be affective, that is the mood disorder, it can be even the schizophrenias or the schizoaffective disorders or any kind of phobias. One should know how to psychologically analyze these individuals. Maybe these can be the patients, maybe they're not the patients, even if they are the normal individuals. The psychoanalysis is sometimes very important. So the Freud's psychoanalysis will be discussed over here. Freud was one of the scientists who played a very important and pivotal role in the development of all of these psychotherapies and the techniques behind them. So we'll be discussing this Freud's psychoanalysis over here, and then we'll move on to the newer therapies. What are the newer techniques in this development after the advancement of the technologies? What are the newer techniques that are devised for the psychoanalysis? That will be also discussed over here. Then we'll move on to the Gestalt therapy. How do you basically define and what are the key features relating to this therapy will be discussed over here in this very second section. In the third section, we'll be discussing another therapy, which is basically known as the person-centered therapy, and then the self-defense mechanisms. So what are the normal self-defense mechanisms that were applied even by the people who are suffering from the mental disorders or even the normal people? They usually apply to these self-defense mechanisms when they are in any stressful conditions. So we'll be discussing this Roger person-centered therapy over here, and then we'll move on to the humanistic approach of the psychoanalysis. That will also be discussed, and that's basically the newer and the more advanced techniques. Then we'll be discussing the different modes of the self-defense mechanisms that were applied by the different people. In the fourth section, we'll be discussing the behavioral therapy primarily over here. First of all, we'll go about the definition of this behavioral therapy. It's also known as the cognitive therapy. And then we'll move on to the hierarchy of fear. So it's again very important that how do you basically move about when we go about and treat these patients with mental disorders. For example, if someone is suffering from fear or some sort of phobia, that is extreme anxiety or worry, how are we going to go about and treat these individuals? Then we have the aversion therapy that will be discussed over here in this fourth section. In the fifth and the final section, we'll be discussing the operant conditioning. So it's again very important. How do you go about and define this condition? What are the techniques that are devised for this operant conditioning phenomena? And then we'll move on to the effectiveness of this operant conditioning whenever we are treating patients with behavioral therapy. We have different modes of conditioning, and specifically operant conditioning is a newer technique, and that will be discussed over here in this lecture. So I hope you want to learn more about these psychological treatments that are used nowadays. So do watch the other sections to this lecture as well.